Okay.
Okay.
Okay. Thank you, Dr. Krigsman, for your time.
No, it's my pleasure. My pleasure.
For me, I'm so curious because we could talk about the perspective on autism from this gastroenterological gut perspective on autism, and it's very important. You have a lot of expertise, so I have some questions, and I would like to ask you. So, how it happened that gastroenterologists, not neurologists, not psychiatrists, treats autistic patients because autism is not gastroenterological disease, or maybe it is gastroenterological disease.
Right. And that's actually a few questions put together, but they're all related. Um, the way the way I became involved in autism is for many years I was working, I was doing general pediatrics and also pediatric gastroenterology. I wanted to continue to do general pediatrics for as long as I could because my teacher, uh, and he was right. He said one thing he said when I was in training was that to be a good specialist, you really have to be a good generalist. You have to be a good pediatrician to be a good pediatric gastroenterologist. So I took his advice, and I was part of a very large pediatric practice. And one of my partners, his name was Marvin Boris, a very interesting man, very open-minded, thinking out of the box. And he was interested in autism. He was a pediatrician allergist, and he was interested in autism from an allergy standpoint. And one day he told me, he said, you know, so many of these kids have gastrointestinal problems. When they talk to me, there's diarrhea, constipation, there's abdominal pain, there's failure to thrive. Maybe you should have a look at them. So that's when I said, okay, I'll look at a few. And I saw them, and you know, my impression was that, you know, they're not talking to me. I really don't know what's a problem, what isn't. Can I believe the parents? I don't know. I don't know. So I'm not gonna. Why should I invest time and energy and money in order to do workups and everything on these children if they're psychiatric patients? So I really didn't want to get involved with them. And then Dr. Boris had somebody working with him who showed me a few publications that had already been published before. This goes back like to the year 2000. Um, there was one publication published before 2000 describing the histopathology in children with autism who have GI symptoms.
Mm.
And I said, wow, you know, from reading the paper, the way they describe the patients, it sounds exactly like the kids that came to talk to me. So I called all those parents and they came back, and I did a full GI evaluation. I decided, okay, I'm going to believe what the parents tell me.
Mm.
The parents say that they know their kid and they think he's in pain.
Mm.
Then he's in pain. And if they telling me about stools that sound strange and smell strange, I'm going to believe them, and I'm going to do a workup as if that were truth. And usually that ended up with the first with non-invasive testing, blood tests, stool tests, and ultimately an endoscopy. And on the endoscopies, the pathologists, this was like 70% of the colonic biopsies showed a lymphocytic infiltration in the lamina propria of the colon. 70% colitis. That's an exceptionally high number. And and also there was also prominent lymphoid hyperplasia. And this is exactly what they described in this paper that I had seen. So I said, maybe something is here. And I began seeing patients. And then within 2 months, people started flying in from all over the United States, and that's not normal. You don't fly in from to see a doctor, maybe with a brain, a specialized brain tumor or an unusual disease, but these kids are coming with GI complaints. Why are they flying in? So that's when I realized that there's no one who's interested in this, and there's something was there, and that's how I got involved in it.
Mhm. Uh, and autism is very complex disease. Like everybody said, it's complex because there are so many things, going on, so many different mechanisms and pathologies. But is there anything which is like a common for like majority? I don't know, maybe if not for 100%, but for majority of the patient. This, inflammation, gut inflammation, you mentioned it's like a 70%. But can you have a conclusion that there is pathology which is like common for every autistic person?
Gastrointestinal pathology
Um,
in general. I don't know. I mean, I think what you're asking is there a biomarker of some type
Yes.
that if it's positive, that means it has. So my question to you would be, are you asking that every patient with autism has, or every patient with autism and GI disease has, or every patient with autism and arthritis has? Because there's mitochondrial disease, there's autoimmune thyroid disease, there's autoimmune skin diseases. They have all of these, or they can have any one of these, or a combination. So, people are looking for biomarkers for autism,
Mhm.
just autism,
Mhm.
for a long time. And there's no reliable biomarker yet. There is none. We ourselves we're developing one, and we have what we think are very good biomarkers. We haven't completed that study because something much more interesting and
Mhm.
much more useful for the moment came along. But we're gonna get back to that work. Um, so there's no, right now autism is diagnosed, as only by observation.
Mhm.
There is no test for it. Um, but we know what's common amongst them is that what's so interesting is that the type of delay that they have is how we're able to call them autistic
Mhm.
as opposed to mentally retarded or neonatal asphyxia or post-stroke or other type or Down syndrome or other chromosomal delays. They have a unique set
Mhm.
of cognitive and behavioral deficiencies.
Mhm.
And that having that unique set is what makes them common. That's the best we have so far. Uh, and the way that everyone looks at it, and this may not be correct, that's the starting point. You have a patient with these cognitive and behavioral abnormalities, and then you try and find what other problems they have.
Mhm.
Um, and that's because the cognitive and behavioral issues are the easiest ones
Mhm.
to notice. Anyone can notice that. You don't have to be a doctor. Whereas the arthritis or the mitochondrial disease and metabolic issues and growth issues and a lot of the GI disease, you need to get a biopsy for that. So that's, I think, why the starting point is always developmental. But that leads into your other question. Like if you have other diseases together with your cognitive and behavioral, you have other symptoms like the gastrointestinal inflammation. Well, maybe the cognitive problem is a result
Mhm.
of the GI inflammation. How do you know that's not the case?
Yeah. Mhm.
And the answer is we don't. We don't. There's no.
Here comes the question, like if we find something in gastrointestinal tract, is it comorbidity or it's a part of autism actually?
I think it's a part of autism. I think the same way that um, you can have a urinary tract infection,
Mhm.
and that urinary tract infection may just be a simple UTI, or it may be part of another problem. It could be urinary reflux into the ureter. It could be a bladder dysfunction. It could be caused by many different things. So a UTI, it's a diagnosis, but it also may be part of a bigger thing. And that's the same thing with the with autism, is that the autism, seizures, the GI disease, mitochondrial, they're all part of a big package, which according to the best quality data seems to be immunologic.
Mhm.
So the most common finding you'll find when you screen children with autism are immunologic findings. Different, not all the same.
Mhm.
So it can't be used as a biomarker, but the immunology of these children is clearly abnormal.
Mhm.
Um, Specifically, and the most glaring of which is that you have a pro-inflammatory cytokine presence in the blood of these children. That's the most common immunologic finding. There could be different cytokines. So it isn't always the same one. But a hyperactivated immune system seems to be the most common finding when you have someone that you can call autism.
Mhm. Do you think that in the future we will have kind of biological definition of autism? Because at the moment, as you mentioned, we have this psychological, behavioral definition. We are looking for special features, but still we are finding something, as you mentioned, gastrointestinal, immunological, inflammation. So yeah, and people are looking for biomarkers. Like I was talking to Dr. James Adams, and they are looking for some, toxins in the stool, for example, as biomarkers, maybe for the future. And I will talk to him quite soon about that. But do you believe that we will have biological definition of autism?
I think so. I think if the uh, if the funding agencies, which is mostly the United States government,
Mhm.
they fund autism research the most. If um, if they decide to fund uh, certain areas of autism disease mechanisms, right? I think if certain areas which are not being explored now, if they were to be explored, I think you would have a chance of finding a biomarker.
Mhm.
Um, whenever you have a question, any kind of question, whether you'll be able to answer it starts at how you start. What's your starting point? You have a question for me. Where do I start in trying to answer it? If I start in the wrong place, then I'm never going to find the answer to your question.
Mhm.
If I start looking in a more likely place, then I may very well find the answer to your question. So, and those studies can be done, but for whatever reason, that it hasn't gotten there. A lot of time and money was wasted on genetic research, and there is no autism gene. We know that. Um, uh, and now a lot of money is being poured into the microbiome, like you mentioned, and it remains to be seen if that type of research ends up being a true biomarker or not.
I'm asking the question because I'm looking for the solution for the patients because I'm not happy with, supporting autistic person with only like a behavioral, support. But, I want to give more, like it's nutritional approach, medical approach. That's why I'm talking. I know that at the moment, we do not have final conclusions and or definition of biomarkers, but still something is in progress, and still I believe we can, and in your practice, you see that you can help many people.
Oh yeah, there's no question about it. I mean, for decades, the real tragedy there's so many tragedies in autism, but maybe the biggest tragedy is that the first clinicians who were interested in that were psychiatrists, right? And they held on to this disease for decades, decades and decades and decades. And maybe at least 3 generations or more of doctors were taught that this is a psychiatric disease. And to change your mindset and look at it as, no, this is a medical disease, is turning out to be much more difficult than I would have thought. Yes, I am hoping. I do treat that the fact that the statement that autism is a medical disease is 100% true. Except in those unusual cases where it is purely genetic. Okay, there are very small number, like 1% or less. But aside from that, they're medical diseases with medical comorbidities. We mentioned them, I listed them before, and those can be treated. And the interesting thing is that we found that as far as the gastrointestinal inflammation, when that's treated, you not only improve the gastrointestinal symptoms, but you also improve, we've shown this now, but you also improve the cognition and behavior in these children. And that was a surprise because, and it's not because, well, if you feel better, you function better, right? Anybody, if they feel good, they function better. If they feel bad, they function bad. It's beyond that. When their GI disease is treated properly and they have no more GI symptoms, what we found is that their level of thought, their level of understanding, their ability to communicate either verbally and non-verbally, the quality of their thoughts improves. It's not just functioning, basic functioning. And I did not expect to see that. I really didn't. And but we're delighted. Parents are very happy to know that because now, we can say that treating gastrointestinal disease is one more treatment for autism in general.
You mentioned inflammation, immune system, gastrointestinal tract. We are talking about how neuroinflammation can affect development and function of nervous system. But can we have an idea what is first? What is the beginning? What is second? Or it's also hard to say because everything is touching the other problem.
It's impossible to know what comes first, because when you're looking at a patient with autism, the parents are always telling you a retrospective story. Right? They're not coming to you at the beginning of the problem. They're coming to you when the kid already has behaviors and has delays and has other things happening for a while. You're never seeing it from the very beginning. It isn't like, someone comes with a sore throat and they come to the doctor the next day and he sees that does a culture, it's negative, and then the next day the kid has fever, you look at his throat again, and now there's pus there. So you can see a development of a disease. With autism, as clinicians, we're always hearing the story that happened. Oh, it began 3 years ago. It began 2 years ago. So it's hard to figure out what comes first. Now there are some studies that where researchers have looked at the siblings, younger sibling of an older patient with autism, and they study them very carefully from birth to see how things develop. And even amongst those studies, there's no clear road as to how some patients take different roads, but they end up having autism. That was as far as symptom appearance. Does the OCD come before the anxiety? Does the GI symptoms come before the development of developmental delays, or only afterwards? It's still not, even when you look at them carefully, it's still not clear. So it's a hard question to answer, but it's an important question to answer.
Sorry that my questions are maybe theoretical, but I really want to know your thoughts, your ideas, because like we are talking and we are kind of building some structures, some ideas. Like when I'm thinking about gastrointestinal tract, gut actually is the biggest organ of contact with external world. So actually gut is like eye or hearing, like an organ of contact of our brain. And we have, this gut-brain axis. And somebody says that it is like a highway, that there are 9 lines upwards and only 1 downwards. So it seems like if we ask the question, who is in charge, the brain or gut, it maybe seems that gut is really in charge of governing our brain. So can you explore maybe this topic of connection? Like, what do you think about that?
People have looked at it, right? And people have published on it, and there's still nothing has clarity. The papers that are published on that are mostly theoretical and hypotheses. And I'm not aware of any publication that has shown with good quality data that either one of those two is true. So you asked me what my opinion is, right? What do I think? Okay, so knowing there is no fact yet that we know of. My opinion is that because the most common denominator in the various comorbidities is immunologic, that makes me strongly suspect that the first problem that these kids have is an immune one. Meaning I do believe that these kids are born, the vast majority are born normal, and then something happens to their immune system, and they start becoming abnormal. That's the whole idea of regression. Where you lose milestones you previously had. Some patients will say they didn't lose milestones, they just gained them really, really slowly. So even that, it's all the clinical presentations that we normally use as clues, they're not reliable. But when you look at their blood testing and even the kinds of diseases they have, the frequency of autoimmune diseases, comorbidities, is so high. The arthritis, the thyroiditis, the psoriasis, the food intolerances, these are all immunologic. And that makes me think that the primary disorder is immunologic, which is why I personally think that I'm personally most excited about the idea of a successful stem cell transplant. There's all kinds of mixed data, and it's certainly not a guarantee, and the success rate is not as good as we would like it to be. But the idea of stem cells is ultimately a replacement of the immune system. And that idea is one that I think is going to get us the furthest in treating them.
Okay, it's important for me. Thank you. I want to go back to one of your publication or your research. I think you have used this phrase enterocolitis autistica, like this. Is it something different comparing to different enterocolitis? Is enterocolitis autistica different comparing to the inflammation with the other diseases?
The other diseases of the intestine?
Yes, yeah.
Yeah, so it is. Just like celiac disease is inflammation from a certain type, and you look at it, it's a certain type, certain location. Also, there are different types of inflammation. You can get an enterovirus, a viral transient viral infection, and that's a certain type of inflammation. Rotavirus, you can get infections like Clostridia, which looks a certain way. So the inflammation is different in different gastrointestinal diseases. The inflammation of the intestine in autism is different from all of those. It's different when you look at it through the scope. It's different when you look at it under a microscope. And it's different when you look at it at capsule endoscopy with the small intestine. So it is unique, and it's only seen, as far as we know, it's only been described in children who have autism. And that's what makes, it doesn't prove, but it's a strong argument that the two are related, that having the specific cognitive and developmental delays is related to this specific and unique intestinal inflammation.
So what's the difference on microscopic level? I'm sorry, I'm not, pathologist, so I will not look myself, but I'm curious.
That's okay. So that was published back in, I think it was 2003, 2004. So this is not new information, and this is old information, really. It's just for some reason, it just hasn't caught on. Again, part of it is because of the idea that it's psychiatric, but there are other reasons also. The types of cells, the subpopulation of lymphocytes are unique in this disease. The presence and location of certain types of complement is unique in this disease. And also the degree of lymphoid hyperplasia is marked. It's huge. Okay, so in the intestine, you're going to have some areas that have enlarged lymph nodes because, like you said before, it has the most lymphoid follicles of any organ of the body, and when it encounters something foreign, the outside world, you're going to have some mild increase. So, having some degree of lymphoid hyperplasia is normal. But when you put a scope in, if you're an experienced endoscopist, and you look at the size of these lymph nodes, it's striking. And so I did some work years ago, did some research to try. Has anyone ever tried to define how big is acceptable, normal, right? Normal response by a healthy immune system, and how big is an abnormal response by a diseased immune? And there is none. There is no data. But so all you do is, when it comes to the lymphoid hyperplasia part of it is, experience. You put the scope in and you say, this is way not normal. And but it's a very important clue, because that means, again, that the immune system is abnormal. It's being triggered and triggered and triggered and triggered, and it's not turning off.
Okay, but it sounds really as a potential biomarker for the future. If there are some characteristic features, maybe in the future it's going to be part of a list of some biomarkers.
So that's work that we've done. We published a paper in 2013, and 2016,
Mhm.
two papers that dealt with some of them. It was RNA transcripts
Mhm.
um, in different bowel inflammatory diseases. And that's part of the biomarkers. But yes, you're right. The fact that we know that it's different
Mhm.
than other diseases does make me pretty confident that with the proper amount of funding and manpower, we can find
Mhm.
that biomarker.
Okay, another question I have actually is I'm curious about your everyday practice because I'm clinician. I have seen today few autistic patients. I will see them like tomorrow, maybe after weekend. So I like science, but when I'm looking at some publication, I'm thinking how to translate it into like everyday language, what I'm doing with my patient. That's the question. So my question is, for example, you see for the first time a new patient with diagnosis of autism. So what you do with that patient? What kind of diagnostic tests? What therapies or treatments they are in your mind? How it look from this point of view, point of view?
Okay, so those patients are not the ones that come to me.
Mhm.
The patients that come to me are patients who already have an established diagnosis and there are GI problems that they're having. And they've usually been to one or two gastroenterologists before me who haven't been able to help them. And then they hear about me or they're told about me. And then at first they go locally, to whoever their doctor sends them to. And then if there are no results, no improvement, then they start doing their own research. And that's the ones who I see. So they all have GI problems. Um, so it isn't that I'm taking an autistic kid and trying to see what I can do for them. They're coming to me for the specific problem of gastroenterology. And that's what I treat.
Mhm.
Okay, that's what I treat. It turns out, right, after 20 years, we learned that treating the gastrointestinal inflammation also treats their autism. But that's not the reason they come to me, and that certainly isn't even my goal at this point. My goal is to diagnose and then treat whatever GI issues they're coming in with.
Mhm.
So it's not, I can't really answer your question. Now, if you were to ask me if they come to me with autism and a GI problem, how do I go about evaluating them?
Mhm.
Right. So that's a very interesting question. I spent a lot of time on that. Okay. Um, and because they don't communicate for the most part. For the most part, they can't communicate, right? So the uh, the strongest tool that a clinician has when you meet a patient is you say, "What's wrong with you?"
Mhm.
And they tell you what's wrong, and then from there you know what to do, right? That's the very first step
Mhm.
is to get the history, right? I haven't got that tool. We haven't got the patient's ability. So it's all the parents interpreting. So the very first thing is to try and pull apart what the parents have actually observed and what they think.
Mhm.
Okay. So, I am interested in what they think, but I'm more interested in what they see with their eyes
Mhm.
because what I learned, and the point of this is going to answer your question, is that GI symptoms, right? Symptoms are something that the patient themselves says that you wouldn't know unless they say so. Whereas a sign is something that I can see in you. I can see that you're distended. I can see that you're jaundiced, right? Those are signs. Symptoms is pain,
Mhm.
right? Um, and I had no way of knowing what the symptoms were because they weren't communicated. So what we learned was that GI symptoms are very, very often, if not always, they become behaviors. When you have pain, when you have reflux, right, or when you feel nauseous, okay, or when you're constipated for 3 days and you feel so sick from it, right? But you can't say any of this. What happens is your behavior worsens, various behaviors. It could be aggression, it could be violence, it could be self-injury, it could be an increase in OCD, it could be an increase in anxiety, it could be so many different behaviors. And what I learned over the years is there are certain behaviors that you see that most likely reflect gastrointestinal disease and others that are less likely. Right? So the kid who is banging their head every day and they never did that before, right? That turns out not to be a common manifestation of GI disease. But aggression, attacking you, that's a very common indication of GI disease in particular. So the first thing that I would tell a patient is I would tell them this, that a GI symptom, right, is manifest as a behavior. Now, if they go to a psychiatrist, the psychiatrist hears aggression, self-injury, and they give them their psychiatric drugs. But this is the reason why that's not the right thing to do. It's because when you have extremes of behavior, it's usually because there's something medical going on. And that's the first, that was a theory that I had. And then as new techniques for communication became available, like you've heard of spellers and spelling to communicate, and those are different things, but the child can point to a board and actually write, and they write beautiful sentences. So the thoughts are there at a high level. And I would ask those patients then, okay, when I gave you that medicine, right, what that did it help you? And if it helped you, how did it help you? When I gave you that medicine, and they would tell me, they would say what part of the abdomen was hurting, what got better, what got worse, and that's how that confirmed to me that the behaviors. And they said the reason why I become aggressive is because I'm in pain. They tell you that, those who can. So that's the very first thing, is to realize that behaviors are very often a manifestation of a gastrointestinal condition. Now, it's not specific to inflammation of the intestine. It could be reflux. The child could be refluxing, and the pain of the acid esophagitis can cause them to have the same type of behavior as an enterocolitis. That's when you have to start putting together other symptoms, diarrhea, right? Fevers, elevated inflammatory markers. You have to start using both your laboratory values and the story, but the history has to be very specific. And it was over many years, a number of people, not just myself, have developed very good questionnaires to ask parents. There's one called the ATAC, ATAC, from the Autism Research Institute. And that's a very good general one. I have my own GI questionnaire that I developed for our own studies. But that's the way you're going to get the basic story, and that's how you're going to know what the next thing to do is.
A question: is it possible to share your questionnaire with me?
Is it what?
Can you share your questionnaire, your own with me? Can I see the questionnaire later on? Can you send me?
Yeah, absolutely.
Thank you.
Absolutely, sure.
Okay.
I have a lot of questions. I have a lot of questions that I still don't know. It will be a long list. But I think the most important of the questions is, why is this kid behaving so badly? And the parents desperately want to keep the children at home, But the behavior sometimes is so bad, the aggression is so bad, they can't. And that's terrible because they know that if they send to an institution, they're going to get full of psychiatric drugs. And they know that's not the answer. And that's tragic. So to be able to identify and treat GI disease and get rid of that problem, right? Just that alone is such a major success. And that's true with kids who have seizure disorders and the kids with arthritis, any one of the diseases that we can treat and get rid of, even though the kids are still autistic. But we make major progress in them. So, but there's still other questions as far as mechanism and those things. Yeah.
The last question for today. Remember that I'm looking for the solution and I want to help as many people as possible, and do not get angry at me with that question. I'm thinking, what could be your advice for parents of autistic child? Because some, majority of them, they will be not able to find the doctor who knows what to do with autism, and they really want to help the child. Is there anything from the perspective of gastrointestinal tract that they?
Yes. The best thing, unfortunately, but this is the answer to your question, the best thing is to educate themselves. They have to educate themselves. They have to trust their intuition. If they think something is wrong, right, they need to search and go online. And I don't like recommending one online group more than the other, but the one that I found is most helpful for patients as far as educating them. It's called TACA, TACA. And that stands for Talking About Curing Autism. And what makes them unique is that education is really their main goal. So there are lots of other organizations that do want to educate also. But I think TACA it's been around for a long time, and they're very well organized, and a patient from Europe or anywhere can speak to a person from TACA, and they have a whole bunch of volunteer parents who'll speak to anyone about their experiences, what they know. And that's how patients have to learn a lot of this on their own. Okay. And that's the best and they learn it from other parents, other families. And number two is trust your intuition.
Thank you very much. Dr. Krigsmana, I'm really grateful because you gave me even today many ideas for me as a doctor to.
Good. Good.
Also, this is inspiration and help for parents, for patients. So thank you very much for today.
You're very welcome. It's a pleasure speaking to you. I look forward to speaking to you again.
Yeah, I hope that in the future we'll talk more about autism, about your research, your publication. So get ready for me once again.
I'm ready. All right. Take care. Okay. Bye-bye.